Hi, good morning. I'm Lokesh Prasad and I'm the MD for AliveCor in India. Vaibhav, Manish, really excited to be here today talking to both of you. I think it's the culmination of several months of hard work that our teams have put together. The collaboration between Portea, NanoHealth and AliveCor, I think has the potential to change how high-risk cardiac patients are taken care of, and how people who are just interested in overall wellness can use this platform to take care of their health going forward. So really exciting.
Wonderful, Lokesh. Totally agree with you. I am Vaibhav Tiwari. I am CEO and co-founder at Portea. And it's great to be part of this initiative, Heartsmart. I think with this, we can democratize heart care actually and take it to patients' homes. And I'm very, very excited that we as a company are participating in this initiative.
I am Manish Ranjan, CEO and co-founder of NanoHealth, and our goal has been how to make the existing health systems a lot more proactive, coordinated and continuous using technology. What we are doing through Heartsmart and this partnership of AliveCor, Portea and NanoHealth is bringing these various pieces of otherwise fragmented healthcare under one umbrella and making sure that the patient gets a continuous care. Such type of care is very unique and long wished for. So very, very excited, and thanks for both of you and the entire team backing us up to putting this together.
So it's really great. At least as far as we are concerned, our KardiaMobile 6-lead device is a very unique device. It's the only device in the personal ECG space that is US FDA cleared. Now we are in India, and the insights that a patient and the physicians that Portea is bringing to the table, that they can derive from a 6-lead ECG from patients who are sitting at home, I think it can be a crucial factor in determining how the patient lives his or her life going forward. So it's brilliant that we can bring these kinds of technologies together and partner with a company like Portea to bring in that back-end services layer and offer it to the market.
Yes, I totally agree. I think from our perspective, our expertise lies into taking the services to the patient homes and making sure that they are able to take care of their health, whether it's a chronic disease or it's basically post-operative care, any of the healthcare requirements. Our whole expertise is in making sure that they are taken care of well at home and they heal at home much better, and of course even from preventive care perspective, and that's what we are probably looking at over here, saying how can we make sure that patients are able to take care of their hearts actually and the health of their hearts in a very, very proactive manner. And I think so that is one thing where I think we in this collaboration will to add tremendous value to patients and consumers to take care of their heart health. And I think on top of that, we could also add a lot of support from diagnostics perspective. Patients who have been having heart disease and are using this solution, they're the diagnostics like lipid profile and reading those ECGs and getting back to them to make sure that they are taking care of their heart's health proactively. I think again something where we could be able to add value and really help patients to live healthy lives.
Absolutely. So healthcare value chain is very long, right? From when a patient identifies that there is a cardiac care to actually, making sure that it doesn't gets worse, and there are a lot of different stakeholders are required. Like, where you mentioned that, lipid profile, there has to be testing done periodically, and most of the time we are busy and there are no symptoms, we just forget about it. Putting together devices like, AliveCor, which is so convenient. When we have used it extensively and we have seen that people come up what would otherwise take like 30 minutes, a lot of inconvenience in taking the shirt out, trousers out, and then making sure that there is a lot of cleaning that needs to be done after that, and then now suddenly it's a 30 seconds thing, and which can very easily be done at home, and so bringing all of this together under one umbrella, bringing all kind of data that allows a doctor to take the right decision unfortunately or unfortunately, it's something like, until it happens, you don't value it enough. But this is something which we will be able to show with data that this could have happened, and now we have been able to prevent it. So it's amazing, and I really believe that's not only in India. Worldwide, such kind of collaboration coming together, such kind of data being coming together is going to be unique. So, really, we have put, from our end, we are putting our best foot forward to make sure that this is the best experience for, every stakeholder in this long health value chain.
And given the pervasive nature of cardiac disease and other kinds of disease that impact your cardiac health, like diabetes or chronic kidney disease or obesity, those kinds of comorbidities that exist. So really the number of people who are impacted, I mean, there are estimates that say that 25% of deaths in India are because of cardiovascular disease. And the number last year was around 1.7 million people. Given the scale of this problem, the ability to reach out to the masses and make it convenient for them through Portea's home care service. And of course, we provide the ECG technology and AI on a common platform that Nano has developed with multiple devices and an EMR at the back end.
Right.
I think this is of great value. And I'm sure that, when we launch this, we will have a proper plan to educate India about what this can do for our overall cardiac health. And I think that's what excites me, because finally the reality is 99% of the time a cardiac patient is not in front of their doctor. They are at home or in the market or in office. Right. So how do you create that ability to reach out to them when they are not in front of their doctor?
No, I totally agree. Lokesh is a very valid point. I think the studies show there's a very strong correlation between cardiovascular diseases, diabetes, and kidney disease actually. And I think if patients who are diabetic are very prone to 2 to 4 times more prone to develop CVDs or have kidney diseases, I think. And if we know that particular segment can be taken care of in a big way, because they are more prone to catch diseases. So working with them, making sure they're taking care of their heart health becomes very, very important. And I think that's where this whole program of not only curative but also preventive healthcare becomes very important in this particular case. And you're mentioning about the whole wellness piece. I think patients who are having problems, how do they take care of heart health in proactive manner, as well as the patients who probably have had an episode or so of CVDs, how do they make sure that they ensure continued precautions and good health for their hearts, becomes very, very important. And that's why launching this solution is not only for taking care of heart patients, but also of a much, much larger population. So in that sense, it's probably first of its kind innovation and first of kind initiative in this country. And I'm sure that with the support of medical fraternity and from our patient perspective, I think it will go a long way. So wonderful initiative.
No, absolutely. And so for taking any of this long-term care, and especially after someone has identified with cardiovascular problem, it requires, diet to be right. It requires, periodic consultation with doctors. It requires, periodic ECG taking, which they don't do it. But now with the convenience of AliveCor's, Cardia, will be able to take it periodically. Then again, any questions that they may have to nurses, the BP monitoring periodically, and actually measures the BP maybe, but there is no recording of that which is taken, right? And so bringing all of this together in a periodic fashion for a longer duration, which is actually required, that's is very overwhelming for a patient also, and also for the provider, because at scale, and that's where technology like ours, we believe, can really support in making sure that at first all this information comes together, and the doctors and dietitians and can provide get the right information about the patient, very personalized, and can provide the personalized guidance to the patient at their home as well. So bringing the level of convenience, bringing the level of effectiveness and efficiency in this entire health value chain, I believe is going to be a game changer.
It's just the start, and I think it's really up to us to make sure that people understand what we're trying to do. By people, I really mean the users. By users, there are two types of users. There are the doctors who are taking care of their patients. How a technology like this can bring benefits to them, because they're going to be a critical part of this whole ecosystem. And then finally, the patient at home, or just a wellness enthusiast who just wants to make sure that they are okay. And bringing all of this together, the three of us, plus other devices. So we're bringing in digital blood pressure monitoring technology, etc. I feel very, very positive, and as we launch, it's coming close to the launch date. I think all of us and our entire teams who will be working on this, they're really excited to take this to market. So I guess good luck to all of us.
Yes, very well said, Lokesh. I think the way we look at it, innovation in healthcare today's time is probably the most exciting thing to be part of. Especially post-COVID, we are seeing tremendous innovation using technology, using AI, using other technologies, and I think putting something like this together and taking out to the market to support patient is a wonderful initiative. And we are very happy that we are launching it on 1st of June.
Yes.
And look forward to working with both of you and making it successful.
Absolutely. I mean, I have personally been in healthcare for the last 6-7 years, and one of the things I always wished for is the collaboration, because healthcare value chain again is so long, that so diverse, and everyone's expertise is so unique, and just the fact that we are able to come together and making sure that to the end patient, to the end user, it's a complete solution, and not like someone from something from AliveCor or Portea or NanoHealth. I think that's where it's a winner from the start, and that's where Heartsmart, launch of Heartsmart on 1st June. Very excited for the impact that it's going to create in masses.
Yeah, Manish, it's not always easy to find good partners, but I'm glad you're sitting right? It's really great that the level of excitement I see all in other offices, etc. So 1st June it is, and like I said, good luck to all of us, good luck to our teams, and hopefully we'll be able to make sure that the message goes to the market.
Yes.
And people benefit from this. Most important,
yes.
People have to benefit, otherwise there's no value in this program, right?
Absolutely. Yep. Partnership.